So in this video, we're going to talk about a concern that both men and women deal with pretty regularly, especially as you get a little bit older, and that is low libido or low sex drive. So in this particular video, I'm going to talk about low libido or sex drive in men, and we'll cover women in another video or maybe a few videos down the line. But for men, what are the causes of low libido? And then in the next video, I'll be talking about one of the well-known treatments for this issue. So if a man has decreased sex drive, low libido, decreased interest in sex, one of the number one culprits is medications. Okay, so let's go through this a little bit. Blood pressure medications such as ACE inhibitors. One of the most common ACE inhibitors is lisinopril. Beta blockers are also a culprit here. They are also a category of blood pressure medication. Beta blockers like metoprolol, among others. Also cancer treatments like chemotherapy, radiation, hormone therapies for prostate cancer, steroids, both corticosteroids, which are used to treat a lot of different medical conditions, and anabolic steroids, which are what athletes use to improve their athletic performance. So both of those categories of steroids actually harm the male sex drive. And I think a lot of men probably are not aware of that. They might be aware that corticosteroids, such as prednisone or dexamethasone, can cause a problem, but they may not be aware, especially if they're an athlete, they may not be aware that if they're using steroids to improve their performance, they may actually be destroying their sex drive in the process. Other medication classes that can cause problems, opioids, which are the prescription painkillers that have been in the news because they are so highly addictive and cause all kinds of problems. And just in general, you should stay away from opioids. Just stay away from them. They just cause way too many problems, and they're highly addictive. And another class of medications that often gets missed by doctors. If you are on an antidepressant or a medication for anxiety, or even a medication for something like bipolar disorder, the antidepressants and even some of the antipsychotics and drugs like lithium that are used to treat bipolar disorder, these drugs cause all kinds of problems with sex drive and libido for both men and women. And honestly, it doesn't really get talked about as much as it should. You know, most doctors will prescribe these medications because the patient needs help with depression or anxiety or something like bipolar disorder, without necessarily thinking about the impact on the patient's sex life. And then patients often end up, really frustrated, especially men who are used to having a high level of libido or a high sex drive, and all of a sudden it just isn't there. And they have no idea that it's the antidepressant that they just started or the anti-anxiety medication that they just started taking. So just be aware of that. If you are depressed or anxious, you're going to have trouble with your sex drive anyway. But just be aware that some of the medications can cause problems with with sex drive. So that would be something to discuss with your doctor at the time that they're prescribing the medication, or if you've been on the medication for a few months and you're noticing a change that you don't like, make sure you mention it to your doctor. Make sure you tell your doctor, I'm not happy with, what this medication is doing to my libido, and you can figure out a solution, okay? So medications are number one. The number two major cause of decreased libido or sex drive in men is certain illnesses or disorders. So type 2 diabetes. Why does that cause a problem? Because type 2 diabetes affects the vascular system as a whole. So it affects everything from the heart to the blood vessels to the blood flow to every part of the body, including the genital area. So type 2 diabetes, because it causes vascular damage, can decrease your libido and sex drive. It also can cause erectile dysfunction. Cancer is another big one. Obviously, if you are really sick with cancer and you're on chemotherapy or radiation or other treatments for cancer, you're just not feeling well in general. And part of that is going to be a loss of libido. High blood pressure, same as type 2 diabetes. It causes vascular damage and will affect libido for that reason. Also the same thing with heart disease, kidney or liver disease, lung disease, all of these things, because if you have kidney, liver disease, or lung disease, you don't feel well, right? You're sick, and you're just not going to have the same sex drive because of that. Obesity is another one that's greatly, nobody talks about it. Nobody talks about, doctors don't talk about it, how obesity affects sex drive and libido, and how you feel about your body, how you feel about your body image. That's for both men and women, but in this particular video, we're talking about men. If a man is significantly overweight, he may joke about it, he may laugh about it, but really, in most cases, most men feel kind of embarrassed about their weight. They feel embarrassed about their, big belly or whatever it might be. And that does affect libido. It affects sex drive. There's no question about it. And it's something that gets under-discussed, I think, between doctors and patients. And then last but certainly not least is sleep apnea. Sleep apnea causes problems because obviously you're not getting quality sleep. You're getting a very poor quality of sleep when you have sleep apnea. If you don't know what sleep apnea is, that's a disorder where you literally stop breathing many, many times over the course of the night. And oftentimes you will snore very loudly, and oftentimes you will sort of gasp for air or even gag yourself in your sleep. And what happens is you're just waking up many, many times throughout the night, and you're not getting quality sleep at all if you have sleep apnea. If you're not getting quality sleep, what happens is the body goes into a stress response. You can end up with high blood pressure and a whole bunch of other problems. Also, sleep apnea goes along with obesity. It goes along with high blood pressure, goes along with a whole bunch of other medical conditions. So if you have sleep apnea, it's going to cause problems with your sex drive. Number 3, this should be obvious, but I wanted to mention it because it's important. Relationship problems. If you're not happy, if you are married or partnered and you are not happy in your marriage or partnership and the relationship is not going well, it stands, I shouldn't even have to say it, but I think it's important to mention for the purpose of this video, because sometimes you can get lost in the weeds looking at medications or medical problems, and the real problem is the actual relationship that you are in. So if you are not happy, if you are married or partnered, and you are not happy in that relationship, that relationship is stressing you out, it's not fulfilling, it's not working for you, or maybe your partner is sick, maybe your partner has major health problems, and that's causing you, both you and your partner, stress. That obviously will affect your libido and sex drive. Going closely along with that is number 4, which is too much stress. With any of these things, if you have relationship problems, you have stress. If you have a major medical problem, you have stress. If you are on medications for a major medical problem, you have stress. So, and we're currently living in a very stressful time. So too much stress, you can't relax, you just can't have the same libido or the same sex drive if you are under too much stress. I think everyone knows that, but I think it's important to talk about. And then lastly, too much alcohol and or recreational drugs, things like marijuana, etc. Like any too much alcohol or recreational drugs, it just doesn't work when it comes to sex drive, especially in particular alcohol. Alcohol is a central nervous system depressant, so it literally suppresses your sex drive, and so if you're used to having a lot of alcohol as part of your routine on a Friday night or Saturday night, or when you're having a good time, just be aware that it can and will decrease your libido and sex drive. Okay, so that pretty much covers the main issues for loss of libido in men. There are other causes, but these are sort of the big ones. These are the main ones. And always, always, always discuss it with your doctor. If you don't feel comfortable discussing it with your doctor, you probably need a different doctor. Okay? It's very important that you feel comfortable to talk about any health issue, and low libido, low sex drive is a health issue. Okay? So don't feel embarrassed to talk about it. Make sure that you bring it up with your doctor, and again, if you don't feel comfortable bringing it up with your doctor, you probably don't have the right doctor. Okay?